Today, in the media conference with Lal Goel, which is brought to you by V4 News, Global TV, V4 Stream, Malladu TV, News Gaon se, Samvad Sarokar News, Organ Donation India Foundation and Gyan, our endeavor is to bring to you, enlighten you the current topic. And today our topic is COVID-19, testing, vaccine, what next? We are in this together and we will get through this together, said United Nations Secretary General. Testing. COVID-19 testing involves analyzing samples to assess the current or past presence of SARS-CoV-2. The two main branches detect either the presence of the virus or of antibodies produced in response to infection. Tests for viral presence are used to diagnose individual cases and to allow public health authorities to trace and contain outbreaks. So today we are going to discuss the COVID-19 testing, vaccine, what next? And we have a very elite panel with us, those who are expert in their field. I would like to invite my first guest, and he is Dr. Ramen Goel. Dr. Goel is the president of Indian Association of Gastrointestinal Endosurgeons, IAGES, which have more than 8,000 surgeons as members. Dr. Goel has been conferred recently the honorary FRCS by Royal College of Surgeons, Edinburgh. Dr. Goel is also the associate editor of Journal of Minimal Access Surgery. Dr. Goel is a renowned bariatric surgeon based at Mumbai. He has published many research articles and book chapters. Dr. Goel has also helped formulate national guidelines for surgical practice during COVID times. Now I would like to invite Dr. Goel to give his views on the today's topic, that is COVID-19 testing, vaccine, what next? Dr. Ramen Goel, please.
Thank you so much. Thanks for inviting me on this channel once again after almost 5 months. I think last time we were here on July and we thought by September this would be over and you will not need our presence again. So thank you so much. And it's unfortunate that COVID has been going on for almost 8 to 9 months now. At the beginning, I would like to say that over 1.5 lakh Indians have lost life from COVID. And it's a tragic loss of lives, not only for those who were lost, but also for their families and friends. And I think this is one thing we must remember for this pandemic. Much closer to us is the loss of those doctors, hundreds of doctors and their family members. When we count loss of healthcare workers, we only count the loss of doctors. But we don't realize so many of us, so many of the doctors have taken this infection back home with them, and their family members may have been lost, their mothers, their brothers, their sisters, or their children, and who are not counted. And these are the people who, the doctors who are working for patients, whether for COVID patients or for non-COVID patients, to provide an essential services. And in the process, they got infected. So it is like a soldier on the war front who gets injured. But when a soldier gets injured or dies, it's one death. But here, the doctor, when he goes back home and infects a family member accidentally or without knowledge, the family member is also equal martyr as the doctor. So I think it's important that the whole nation and the community realizes the sacrifice that doctors are making in this process. Friends, we have gone through very difficult times in last 9 months, and all of us have discussed it repeatedly. But I think now the time has come for optimism. We are coming out of these difficult times because of various reasons, and we'll discuss this in today's program. The more important thing is that the patients who are non-COVID, and because the hospitals were overworked or they were They were told not to come for treatment. Thousands and thousands of patients have been denied or their treatments have been delayed. This could include surgeries, patients who wanted a surgery in March or April or May, their surgeries got delayed. Patients of cancers, where treatment was delayed because non-availability of treatment, and they have developed an more aggressive tumor in the process. And it's unfortunate that those people are going to suffer for years, or they may lose their life because of this COVID in next 2 to 3 years. Pregnant women, even simple diseases like diabetes, tuberculosis, the treatments have been delayed and denied. And in the process, these people are going to suffer for years to come from the complication of, let's say, diabetes. There is a study from UK which shows that only in COVID times, about 4 lakh people will become obese because of the changed lifestyle, because many of them are not exercising. Now, these are the figures from UK. We don't have the figure from India, but this is a fact that COVID is not only about COVID alone. It's about overall health of individuals, and which is a major problem. But as I said, that now we are seeing light at the end of the tunnel. And it's primarily because of our scientists and science. Those who are doing research on vaccines, those companies who have invested in the governments who are supporting vaccine development. We have waited for almost a year now for vaccines to come, and we are very glad that we are at that tipping point. So if there were turning points in the COVID, probably this is the most important turning point, that vaccine is now seen. A lot of discussion has happened about how individual country managed their COVID, and this is not the time to discuss the how each country did it. But I believe this is again a time for India to redeem its image. Time has come for India because of many positives that India has as far as vaccination is concerned. We are the largest vaccine producer for COVID vaccine in the world. We are the only country which has 3 to 4 vaccine candidates. That means 3 or 4 types of vaccines which are being produced in India, and in quantities of, let's say, 10 million each of these producers. So that means about 1 crore vaccine will be produced by Serum Institute. 1 crore vaccine, today morning news was there, will be produced by for the Russian vaccine will be produced. So like that, if we have 4 producers, we are looking at between 2 to 4 crore vaccines being produced on a monthly basis in India, and which no other country can match. Then there is another thing, is that in India we do not see the kind of resistance that we are seeing in let's say USA. And I think this is because of the political messaging, the right political messaging, where there is no confusion about vaccine. The government is supporting that vaccine production, and also supporting that the vaccine should be used, and not saying that mask should not be used, the vaccine should not be used. So I think a unified messaging is a great benefit to the India, because we do not see that kind of discussion that people do not want a vaccine. I think the bigger positive for India on this is the technology. India has that kind of, let's say, Aadhaar linked, technology driven implementation, where every individual can be identified and vaccine can be given, and they can be followed up for the second dose of the vaccine. I can keep on counting the positive. I think the most important of it is the vaccination base. India has a mass cold chain for vaccination. For polio and triple vaccine, we have shown it to the world in last 20 years. And that vaccination base stretches all the way to the village level, to the block level, that the cold chain can be maintained. And fortunately, India has chosen the vaccines which can be maintained at let's say 2 to 8 degree temperature. So most of these vaccines can be maintained in a normal fridge, refrigerator, and their efficacy can be maintained. I think if the if Indian government and the policymakers provide early vaccination to healthcare workers, as we have heard repeatedly in last 10-15 days, and to high risk persons, the senior citizen, the people with the comorbidities, that will go a long way in reducing deaths. The first target of vaccination should be to reduce deaths in the country. We are probably losing about 500 citizen every day in country. Now that should be brought down as fast as possible, and that is doable with the implementation of a positive policy to identify those people, and they are all known to the medical researchers. And this will also reduce the hospitalization, so it will reduce burden on hospitals, because these are the people who are having severe disease and they are coming to hospital for treatment. So hospitals will see a drastic reduction within 3 months of implementation of vaccination, and that will release the hospital beds for normal care. So as I am repeating myself, it's not about COVID management. Now we should be looking at managing normal, restarting normal healthcare to provide healthcare to the people with other diseases, influenza, tuberculosis, diabetes, hernia, even bariatric surgery, my own field. Patients can come forward. And now as time has come that in a short period of time, we should be looking at restoration of normal activities. Probably, I don't know, but we will probably discuss it today. The travel can happen in the country and internationally without quarantine requirement. If somebody has taken a vaccine, why should that person be asked to quarantine? So a vaccination certificate should be enough to let the person go through seamlessly through the customs or through the immigrations. Vaccinations can restore other normal activities like weddings, like attendance in offices, like manufacturing, because this will reduce the risk of a severe disease. In our own association has decided to hold first physical conference in 1 year in May in Coimbatore. This was a prospective decision taken about a month back, because we want to restore normal activity, and we are very hopeful by February all healthcare workers in India will get a vaccination. This is not only about India. In USA, we have a conference scheduled in Nevada in June. We have a conference scheduled in Barcelona in July. So I think worldwide, we are already prospectively looking at a positive outcome of from vaccine for COVID and for restoration of normal activities. And I think this is not about the larger things, even meeting family and friends. So it's very difficult to visit a friend's house without probably exposing them to the higher risk of COVID or otherwise. So I think this is a time when we should be thinking that vaccine is right there, and this is the time to accept it rather than raise doubts about it. I have seen the WhatsApp University has become active again to raise doubts about this. But I think we have always trusted science. Science was trusted when we eradicated smallpox from India and world, when we eradicated polio from India, and nobody questioned the efficacy of those vaccines. So I think this is a time where we listen to the discussion today from researchers from USA and our virologists from UAE. And I'm an eternal optimist. I think magic bullet is there. We just need to swallow it, and we need to see how it takes us forward as far as our battle on COVID is there. So thank you so much once again, and let's go ahead. Thank you.
Dr. Goel, now that we have COVID across the country in large numbers and tests are available on demand, do you think number of reported cases reflect true picture? what can be done additionally to have realistic numbers? I would like to add one thing. President Trump, in his debate, which we have also heard in India, he made very clearly that three countries, China, Russia, and India, are falsifying, are doing fraud by hiding the actual test and the actual reports. I can't comment because it's a President Trump who is still the president up to at least 20th January, as per the latest reports. We don't know the future. But now I want to know, Dr. Goel, do you think what can be done additionally to have realistic numbers when we have the COVID everywhere? Dr. Goel, please.
Okay, so I think that's a $1 million question. But before that, I would like to clarify that AstraZeneca is a worldwide commitment to supply vaccine at $3 across the world till pandemic lasts. So any claim by any company of supplying at 1,000 rupees or 700 rupees is not valid. There can't be any MRP except $3. And only after pandemic is over, they can increase the charge for developed world. They are still not allowed to increase the charge for developing countries. So that is to put the things in perspective. $3 is the fixed price across the world for AstraZeneca vaccine. Now, as far as testing numbers are concerned, I think the real question to ask is, why did the testing numbers India came down from 14 lakhs a day to around 9 to 10 lakhs a day now? 14 lakhs testing we were doing almost a month back. And now on an average, we are doing about 9 to 10 lakhs.
Can I just correct you, Dr. Goel? It has crossed even 16 lakhs.
Okay, thank you. So 16 lakhs a day, and now we are doing 9 to 10 lakhs a day. Now, I don't agree on this hypothesis that somebody is trying to falsify data. These are all technology-driven systems created. Even if a single test is done in a private lab, within minutes, they go in a central data state-wise and from state to center. There is no human interface to change the figures. So even if President Trump says we defer to that, but we differ from him, because this is not possible in today's time, because technology is the one which is taking care of data safety. Now the question comes, if that is true, why the numbers have come down? In the process, at a time when the COVID was peaking somewhere in April and May, June, there had been a lot of media awareness that you keep yourself at home, quarantine yourself at home. If you have symptoms, even keep oxygen in the societies. Even in Mumbai, we have oxygen cylinders and even ventilators in some societies available. So what has happened is, people have realized that 95% of the persons do not need hospitalization. So if your symptoms are mild, all that you have to do is to reach out to your family physician or a family member who is a doctor. Check your saturation. Everybody has a pulse oximeter at home. Everybody has a thermometer at home in India. And you check your saturation, you check your temperature. And if you have mild symptoms, you don't go to hospital for treatment. Now, when they're not going to hospital, they are also not going to get tested, because the wise family physician or a wise family member says, if you have mild symptoms or no symptoms, why to get tested? So what I feel is, and another thing that you have to accept is, India is the country where you can get this test done even without a prescription. It is on demand. So I can go to a lab, or I can call a lab guy home who will come and take my swab and get it tested. So test numbers cannot decline, because if the patient numbers are increasing countrywide, which are definitely increasing, the tests have to increase. So what has happened is, I believe, it's my hypothesis is, that there is a sort of reservation among the people who have symptoms, you can call it a stigma, that if they get a test done, RT-PCR done, or an antigen done, that laboratory requires your Aadhaar to be given. So that Aadhaar or identification of the person is leading to a stigmatization of disease, and people don't want to be identified. not because they don't want to be treated, but they are doing it because in India we do not have a support system. So if you have a dependent family members, or if you have dependent senior citizen at home who require help in terms of maids or servants, and if you are identified with a COVID, suddenly you will find that there is no help available for your parents to look after them, because everybody will run away the moment they realize they are working in a COVID positive family. So I think the stigmatization because of identification. Now, it was necessary at a stage. I'm not saying this was a wrong decision. It was necessary at a stage where contact tracing was essential. But as Dr. Velu mentioned, and I also agree, contact tracing is over now. All over the country, people are staying at home. People are not getting tested because they know they will get a CT scan done, or they will get an antibody done, whatever its value. Dr. Nishi has mentioned about it. It's not a good test, but people are getting that done. They found out whether in CT they have a disease, or they found out they have already developed antibodies, and they don't go get a, because they are not giving Aadhaar for CT, or they are not giving Aadhaar for antibody. I think its time has come that we remove the Aadhaar linkage to RT-PCR and antigen test, because contact tracing is in real terms not happening. All that governments or state governments are doing is putting a stamp outside your home that this home has a COVID positive person. But they do not even ask whom you met in last 14 days. Where were you? Who are the people who came in touch with you, and who they should be isolated? So I think now we require a change of strategy. And if that change is done, the answer to your question comes, the testing numbers will increase many-fold in this country. And because tests are not happening, the number of identified patients are also less. So I think it's a chicken and egg and chicken situation. What comes first? I think the only thing that we require is to remove the stigmatization of the test, and the numbers will drastically improve, and people will get treatment properly, because then they are openly talking about it like they talk about malaria, or they talk about all other disease. They will talk about it with their family doctors, because they will have a report, and they will go to hospital the moment they become serious. Thank you.
Thank you, Dr. Goel. And according to you, stigmatization of COVID-19 to be removed. I'm sure this is a good suggestion. Let's hope that the government of the day will take. Your last program, if you remember, you recommended local lockdowns. Now, many states have started doing night curfews recently in Punjab, in many cities of Gujarat, Madhya Pradesh. Do you think, and they have started this weekend lockdown also in Delhi. Do you think this is the way forward?
So,
But just please be brief, because we have a paucity of time. Yes, please.
Sure. So I think lockdown, when I mentioned last time, and now it's the same thing. At that time, lockdowns were to restrict the spread of disease, to restrict the people coming in contact. But now the disease is already widespread. So at this moment, if lockdown is at all required, it is only to reduce deaths in hospital, to reduce burden on a healthcare system. There is no other reason or logic to implement lockdown at this time. That is in my perception. So only those cities or communities where hospitals are getting overwhelmed, lockdown must be implemented, so that the hospitals have infrastructure to accommodate people in their ICUs. But if hospitals have enough beds, I don't think lockdowns are required in any city at the moment.
Okay, thank you, doctor. So today you have seen that testing, vaccine, what next? And the question still remains unanswered, because although the doctors try to give the answer, but there is again something is better than nothing. We are human beings. We are not guinea pig. We can wait. Like doctors generally write prognosis explained whenever you go to a physician. Why? The doctor, the sciences have gone up so high. They should explain us very clearly. Yes, it is going to have these side effects. If you can wait, please wait for 1 year, 2 year more. Why should I risk my life just because the government or a scientist or a doctor is saying, no, it's my life? My family is going to be suffering if I am going to die. So the thing, the viewers, you have to choose. But only thing is, there is no other option. And definitely, as all the three panelists says, that government is trying their best to see the safety measures. And I'm sure no government or no doctor or no scientist want anybody should die because of the misuse or the side effects of the vaccine. Thank you very much for joining us today. And today's program has been live telecasted by V4 News, Global TV, V4 Stream, Malnadu TV, News Gaon se, Samvad Sarokar News, as well as it was shown live on Facebook and YouTube.